Ever wondered about Rasmussen encephalitis, a rare and chronic neurological disorder? It's a question not many ponder, but we're about to change that. In the upcoming moments, we'll unravel the mysteries of this less-known malady. Expect to discover what Rasmussen encephalitis is, the symptoms that it manifests, and the treatments available. We'll also delve into differential diagnoses, helping to distinguish it from other conditions. So, buckle up as we dive into the mysterious world of Rasmussen encephalitis. Firstly, let's unravel the definition of Rasmussen encephalitis. This is a rare, chronic neurological disorder that predominantly targets the brain's grey matter. The disease process involves inflammation of the brain, leading to gradual but relentless destruction of neural cells. This cerebral onslaught often results in severe seizures that are resistant to conventional treatments. Although it's a condition that can strike anyone, it's most commonly seen in children under the age of 10. Despite extensive research, the exact cause of Rasmussen encephalitis remains a mystery, adding an element of intrigue to this already complex disorder. What we do know is that the disorder is not hereditary and does not result from prior brain injury or illness. Its sudden onset and relentless progression make it a formidable challenge in the world of neurology. Essentially, Rasmussen encephalitis is a rare neurological disorder that primarily affects children and can cause severe epilepsy. Now that we understand what it is, what are the symptoms to look out for in Rasmussen encephalitis? One of the most common and prominent symptoms is frequent and severe seizures. These are not your typical seizures. They can occur multiple times a day, making daily tasks a challenge. Another sign is the gradual loss of motor skills and speech. The individual may start to struggle with simple movements like picking up a cup of tea or articulating words. This can be distressing as it unfolds over weeks or months. Paralysis on one side of the body, known as hemiparesis, can also occur. It's as if a line has been drawn down the middle of the body with only one side responding. Lastly, inflammation of the brain or encephalitis is a hallmark of this condition. It's this inflammation that gives Rasmussen encephalitis its name. These symptoms can severely impact the quality of life, making early detection and treatment crucial. The symptoms sound daunting, but how do we treat this disorder? The management of Rasmussen encephalitis is challenging, and it's crucial to understand that treatment plans must be individualized, tailored to each patient's unique circumstances. To start, primary treatment often includes the use of anti-epileptic drugs. These medications aim to control the seizures, a frequent and debilitating symptom of the disease. However, it's important to remember that these drugs are not a cure. They're designed to manage one of the most significant symptoms and improve the patient's quality of life. When anti-epileptic drugs aren't enough, or if the condition progresses, surgery becomes a viable option. The most common surgical procedure for Rasmussen encephalitis is a hemispherectomy. This is a major operation where one cerebral hemisphere is removed or disconnected. While it might sound extreme, it can be incredibly effective in controlling seizures, and in many cases it can halt the progression of the disease. But as with any treatment, it's not without its risks. The procedure's impact on the patient's cognitive and physical abilities depends on their age, the extent of the disease, and which hemisphere is involved. This is why it's so important to have a comprehensive, individualized treatment plan. This plan should be developed by a team of specialists considering all factors, including the patient's overall health, disease progression, and personal preferences. While Rasmussen encephalitis is a serious condition, with appropriate treatment, patients can lead a better quality of life. In diagnosing Rasmussen encephalitis, what other conditions need to be ruled out? Several conditions can mimic its symptoms. Other types of encephalitis, for instance, such as herpes simplex encephalitis, can present similarly. Brain tumors and strokes may also manifest similar symptoms. It's essential to meticulously differentiate these conditions, as each requires a unique treatment approach. Misdiagnosis could lead to ineffective treatments and worsened outcomes. Ruling out other conditions is a critical step in correctly diagnosing and treating Rasmussen encephalitis. In conclusion, Rasmussen encephalitis is a complex and rare neurological disorder. It's an inflammation of the brain, typically presenting with symptoms like seizures, loss of motor skills, and cognitive decline. Treatment often involves anti-epileptic drugs, steroids, and in severe cases, surgery. It's crucial to distinguish it from other conditions with similar symptoms. a process known as differential diagnosis. This knowledge is key to providing better care for patients suffering from this condition, and who knows, might even pave the way for a cure in the future. Understanding Rasmussen encephalitis can lead to improved patient care and possibly in the future, a cure.